Start by understanding how high blood sugar or hyperglycemia impacts the limbs, especially in people with diabetes. When blood sugar levels remain elevated for a long time, it can damage nerves throughout the body, but the legs and feet are most commonly affected. This nerve damage, known as diabetic neuropathy, leads to a range of symptoms: tingling, numbness, cramping, and even pain. Some people may notice their feet feel cold or overly sensitive, while others lose sensation altogether. This loss of feeling is particularly dangerous, as it means injuries or wounds can go unnoticed and untreated, increasing the risk of infections and slow healing. Over time, these issues can escalate, sometimes resulting in serious complications like ulcers or even amputation. The effects are not just physical. Living with these symptoms can impact daily life, mobility, and emotional well-being. Understanding these early warning signs is crucial for timely intervention and better outcome. Now let's dive into why nerves are so vulnerable to high blood sugar. When glucose levels are consistently high, several damaging processes are set in motion. First, excess glucose can directly harm nerves by causing oxidative stress and inflammation. This means the body produces more harmful molecules that damage nerve cells and their supporting structures. Another key factor is the formation of advanced glycation end products, or AGEs, which change the structure of nerve proteins and trigger more inflammation. Blood vessels that supply nerves can also be damaged, reducing oxygen and nutrients, which further weakens nerve health. Additionally, a toxic byproduct called methylglyoxal (Mg) can build up when the body's detoxifying enzyme glyoxylase is reduced. Mg causes even more oxidative stress and disrupts nerve function. All these factors combine to create the classic symptoms of diabetic neuropathy: tingling, numbness, pain, and loss of sensation, especially in the feet and hands. Recognizing the symptoms of diabetic neuropathy early is key to preventing severe complications. Common signs include tingling, numbness, burning, or shooting pain in the feet and hands. Some people may notice muscle weakness or a loss of coordination, while others experience increased sensitivity to touch or temperature changes. Diagnosing diabetic neuropathy involves a combination of clinical exams and specialized tests. Doctors may check for sensation using a tuning fork, monofilament, or nerve conduction studies to measure how well nerves transmit signals. Preventing nerve damage starts with good blood sugar control, a healthy diet, and regular exercise. Supplements like alpha-lipoic acid and acetyl-L-carnitine may help nerve health, while vitamin D and selenium are being studied for their protective effects. Early intervention, proper foot care, and regular checkups can make a significant difference, reducing the risk of ulcers, infections, and even amputation. Staying informed and proactive is the best defense against these serious complications. Looking ahead, research is uncovering new ways to treat and possibly prevent diabetic neuropathy. Scientists are exploring how targeting specific pathways, like reducing methylglyoxal buildup or boosting glyoxylase activity, could protect nerves from damage. Anti-inflammatory treatments, antioxidants, and improved blood sugar management all show promise in slowing or reversing nerve injury. There's also growing interest in the role of immune system regulation, as molecules like interleukin-10 help control inflammation and support healing. Advances in diagnostic tools such as skin biopsies and quantitative sensory testing are making it easier to detect neuropathy early and monitor its progression. While challenges remain, especially in finding treatments that work for everyone, ongoing research offers hope for better outcomes and improved quality of life for people living with diabetes and nerve complications.